Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years, and you're listening to Ask Dr. Leila. Anything you need to know about dentistry, we're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. Happy May, everybody. And as we all feel the weather creeping up, we should still feel super blessed that we had such amazing months. Never in almost 20 years here. I think this was one of the longest, per se, winters we've ever had. Just beautiful. And looking forward, I know my boys have exams coming up. My youngest has GCSEs, and my eldest has end of year exams, which are the predicted grades for university. So our household is all about, studying, staying focused, good bedtime rituals, and what universities to apply to. So I don't know where you guys are in the journey, but it is quite a journey. Okay, today's topic is on chewing gum. Chewing gum in various forms has been around since the ancient times. Sugarless chewing gum may, when added to regular home oral care, routine of twice daily brushing with fluoridated toothpaste or hydroxyapatite, and daily cleaning between the teeth, contribute to reducing the caries risk. Chewing gum increases salivary flow and volume by mechanical action and stimulation of oral taste receptors. The earliest evidence of humans chewing gum-like substances comes from the convergence of anthropology and dentistry at an archaeological site in Sweden, where lumps of birch bark tar with tooth impressions of children and adolescents dating back 9,000 years have been found. The ancient Greeks seem to have chewed on a similar substance known as mastic, from which the word mastication likely derives. Native American Indians chewed gum from spruce trees, a custom adopted by the Europeans who settled in New England. The U.S. chewing gum market is divided by product type into sugar chewing gums and sugar-free. Only sugar-free chewing gums are considered for ADA seal of acceptance. In the case of chewing gum, sugar is defined as monosaccharides, for example, glucose, fructose, galactose, or disaccharides, sucrose, maltose, lactose, but does not include polyols such as xylitol, sorbitol, or maltitol. This is because these polyols are non-karyogenic sweeteners, meaning that they provide a sweet taste but are not a suitable substrate for bacteria in the mouth to use as an energy source. Excluding sugared gum from ADA seal consideration is consistent with efforts to align with recommendations about sugar consumption that suggest limiting sugar intake to 10% or less of energy intake for optimal oral health. Now, it's good to know that although there is some evidence that regular chewing of sugar-free gum may reduce caries risk, this is when it is in addition to rather than a substitute for a regular oral hygiene routine, consisting again of twice daily brushing with a fluoridated or hydroxyapatite toothpaste and daily cleaning between teeth. So for the sugar-containing chewing gum, sucrose, a disaccharide, is commonly used in sugar-containing chewing gum. Sucrose and other fermentable carbohydrates can be metabolized by oral bacteria. These bacteria, particularly the S. mutans and lactobacillus, produce dental biofilm and acid, which can lead to enamel demineralization and caries. The potential karyogenicity of sugar-containing gum depends on the physical consistency, oral retention time of the gum, the frequency with which it is chewed, and the sequence of consumption. For instance, chewing sugar-containing gum before eating foods that reduce acid production will be less karyogenic than the reverse. And then for the sugar-free chewing gum, again as defined in the Code of Federal Regulations, a food or food substance such as chewing gum can be labeled as sugar-free if it contains less than 0.5 grams of sugar per serving. In place of sugar, high-intensity sweeteners such as aspartame, neotame, saccharin, sucralose are used to sweeten gum. Gum may also be sweetened with sugar alcohols such as erythritol, isomalt, mannitol, sorbitol, or xylitol. Unlike sugar, these sweeteners are non-karyogenic, since they are metabolized slowly or not at all by karyogenic plaque bacteria. These sweeteners contain fewer calories than sugar, but the US Food and Drug Administration categorizes aspartame and all of the aforementioned sugar alcohols to be nutritive sweeteners since they contain more than 2% of the calorie in an equivalent amount of sugar. Chewing sugarless gum after a meal can increase your salivary flow by stimulating both mechanical and taste receptors in the mouth. The average unstimulated salivary flow rate for healthy people is about 0.3 to 0.4 mLs per minute. The physical act of chewing stimulates salivary flow. Simply chewing unsweetened, unflavored chewing gum base stimulates your salivary flow by 10 to 12 times that of the unstimulated rate. Flavors also act as salivary stimulants. The stimulated salivary flow rate is significantly greater while chewing sweetened and flavored gum as opposed to unsweetened and unflavored chewing gum base. Increasing saliva volume helps to dilute and neutralize acids produced by the bacteria in plaque on teeth. Over time, these acids can damage tooth enamel, potentially resulting in decay. There are several mechanisms by which stimulated saliva flow may protect against dental caries. Increased saliva flow carries with it calcium and phosphates, which can contribute to remineralization of tooth enamel. The presence of fluoride in the saliva can serve to replace enamel components, magnesium and carbonate, with the stronger, more caries-resistant fluoroapatite crystals. Saliva can buffer the effects of acids in foods or drinks that could otherwise soften teeth's enamel surface, and swallowing excess saliva created by stimulation clears acid. While unstimulated saliva does not have a strong buffering capacity against acids, stimulated saliva has higher concentration of protein, sodium, calcium, chloride, and bicarbonate, increasing its buffering capacity. Additionally, saliva contributes proteins to dental surfaces, creating an acquired enamel pellicle that protects against dental erosion. Clinical trials have found decreased caries incidence in subjects who chewed sugarless gum for 20 minutes after meals. A 2021 systematic review and meta-analysis by Nasirpour examined the use of sugar-free gum sweetened with xylitol and reported the use of sugar-free chewing gum resulted in a statistically significant reduction in the S mutans load. This association between karyogenesis and S mutants is suggestive of the benefit as an adjunct to recommended home oral hygiene. Functional chewing gum is the term given to chewing gum said to have function instead of or in addition to that of traditional chewing gum. Although using chewing gum may have appeal as a means of drug delivery, factors such as dosing and local effects of active ingredients on the oral cavity may be of concern, notwithstanding nicotine-containing gums are among our first line of pharmacological therapies to assist with smoking cessation, recommended by the U.S. Department of Health and Human Services. In addition, there has been aspirin-containing gum sold as an over-the-counter product, and there are several caffeine-containing gums that are commercially available over-the-counter. Oral mucositis is characterized by ulcers and erosive lesions seen to occur in the oral mucosa after radiotherapy to treat head and neck cancer or high-dose chemotherapy used in the treatment of a variety of cancers. The systematic review used to inform the 2021 update to the American Society of Clinical Oncology, Clinical Practice Guidelines for the Management of Oral Mucositis and Xerostomia resulted in the inclusion of a new suggestion clarifying that chewing gum is not effective for prevention of oral mucositis in pediatric cancer patients who receive chemotherapy. In the 2021 update, for clinical practice guidelines addressing xerostomia induced by non-surgical cancer therapies, a cited systematic review included both sugar-free lozenges or chewing gum among the recommended interventions to help with xerostomia experienced after cancer treatment by chemotherapy or radiotherapy. So look for your ADA seal, your assurance that the product has been objectively evaluated for safety and efficacy by an independent body of scientific experts, the ADA Council on Scientific Affairs. Again, a company earns the ADA seal by demonstrating that its sugar-free chewing gum product meets the requirements for safety and efficacy. Efficacy may include one or more specific indications, such as reducing plaque acids, promoting remineralization of tooth enamel, reducing cavities, and or reducing gingivitis. Studies must also show that the gum is safe to oral tissues. The manufacturer must provide the results of laboratory studies and or clinical studies. To date, the only chewing gums with the ADL seal are sugarless. They are sweetened by non-cavity causing sweeteners such as aspartame, sorbitol, xylitol, or mannitol. Chewing sugarless gum has been shown to increase the flow of saliva, thereby reducing plaque acid, strengthening the teeth, and reducing tooth decay. So, a good question for all of you: do you chew gum regularly or not? Personally, if you have TMJ or muscle issues and you're a grinder like myself, I notice that if I chew gum and I chew gum for a good period of time, or there's a bigger piece of gum, I start getting pain, and I don't really recommend it for that. But as you see, it increases the saliva flow, which increases, saliva is great for neutralizing the pH, the reducing the acidity in the mouth, which therefore reduces the chance of getting caries. So all in all, it is a great benefit in chewing gum. And I know also a lot of people use that to help them with, maybe stopping smoking or any other habits they have. They tell me that, chewing gum has really helped. Hopefully this was very informative for all of you, no matter where you stand with chewing gum. And like always, thank you for joining us on the Dr. Leila podcast. Any questions, concerns, anything that you'd like us to talk about in the future, please don't hesitate to let us know. And until next time, have a lovely week, everyone.